Well, thank you for coming today. As you can see, it has been a memorable 8 years for Dalton McGuinty's Fancy Health Consultants. Not because they've done anything to improve patient care. In fact, Dalton McGuinty's Fancy Consultants have never treated a patient, provided an MRI, or performed a single surgery. Instead, Dalton McGuinty's Fancy Consultants have spent the past 8 years living the high life, wasting our tax dollars on $300 dinners, $3,500 hotel rooms, and $7,800 trips to Japan. While Dalton McGuinty looks the other way and keeps signing the checks, this is the story of Dalton McGuinty's 8 years. Tax dollars wasted at the expense of hard-working Ontario families. Dalton McGuinty has wasted money on connected insiders and special interests in every corner of government, but nowhere more so than in healthcare. And this brings us to the biggest McGuinty scandal of them all, e-health. Now, Dalton McGuinty wasted $1 billion tax dollars on e-health with nothing to show for it. That is more money than gets spent on the environment, energy, and labor combined. This begs the question, what did Dalton McGuinty do with our tax dollars? $10 million went to sole source sweetheart deals for Liberal friends at the Courtyard Group Consulting Company. $317,000 went to severance for disgraced eHealth CEO Sarah Kramer. Ontario families deserve change, and Ontario PC government will end the McGuinty-style waste of our tax dollars. We will increase our annual investment in healthcare by $6.1 billion per year by the end of our mandate. And unlike Dalton McGuinty, we will watch where the money goes. If you are a fancy consultant, appointee, or Liberal friend used to living the high life off of our tax dollars, we have a simple message for you. The party is over. Ontario families cannot afford 4 more years of Dalton McGuinty's e-health type scandals. The choice they face on October 6th is very clear. Dalton McGuinty created this mess. Dalton McGuinty cannot be trusted to clean it up. Only an Ontario PC government can and will. Thank you very much, and I'll look forward to your questions.
Leone, what are you going to do about the LHINs?
The LHINs, we feel, is another layer of wasted bureaucracy. This is another group of people who have not seen a patient, who have not provided an MRI, who have not done anything for patient care with respect to treating patients. We're going to close the LHINs. LHINs cost about $300 million a year, and we're going to put all of that money to hiring more nurses, hiring more doctors, and for patient care. So we want to make sure that we're doing the most for patients, putting more money into frontline health care. That's what Ontarians have asked us to do, and we will do it.
Mr. Leone, if the PC government wins the election, will the hospital expansion continue?
That's a very good question. I want to take a step back here and really understand what has happened. Over the last little while, we've heard a lot of nonsense from the Liberal camp saying that they passed a budget that we voted against, funding that would have enabled Cambridge North Hospital to proceed. Let me be very clear. There has been nothing voted upon with respect to Cambridge Memorial Hospital expansion. The budget bill that we voted on May 10th did not include the words Cambridge Memorial Hospital and didn't include expansion. The plan, the infrastructure plan, the 10-year infrastructure plan that the Liberals enacted also did not include Cambridge Memorial Hospital in that plan. So this is an announcement, an election-style announcement on the eve of an election. We heard this in 2007. 2 months before an election, another announcement of a hospital expansion. That's one thing. The second thing here is that the McGuinty government just recently canceled a already under construction gas energy plant in Mississauga. Now, if they can cancel a already under construction project, who's to say they're not going to cancel Cambridge Memorial Hospital expansion where the shovel's not even on the ground? No check has been delivered. We don't have a design plan actually there. And let's be frank, this media availability today is about e-health. E-health is an exercise, a scandal that wasted $1 billion of our taxpayers' money. If we had that $1 billion paid and actually used in healthcare, we could have funded 4 hospital expansions. And that's the record of this government, and they have to live with that. going forward.